Hello, in this video, I would like to summarize Chapter 12 of the book Brain Facts, which is about psychiatric disorders. The table of contents includes OCD, panic disorder, and schizophrenia. I would like to start by presenting OCD, which stands for Obsessive Compulsive Disorder. OCD is a common chronic condition aptly named for its symptoms: uncontrollable, recurring thoughts, and repeated ritualistic behaviors to banish, relieve, or compensate for the obsessions. The obsessions vary widely, from worrying about getting sick to feeling the need to be perfect all the time. Studies have found the brain regions involved in obsessions and compulsions. For example, the basal ganglia help conduct routine behaviors that we call habits. It is also involved in the brain's reward system, our ability to feel good, and learning and memory. Researchers suspect that ritualistic behaviors are provoked by the disrupted signaling between the basal ganglia and the cortex. About 70% of OCD patients gain limited relief with medication, primarily SSRIs, which stand for selective serotonin reuptake inhibitors, and are mainly prescribed to treat depression, particularly persistent or severe cases. If SSRIs don't work, other approaches include medications such as neuroleptic drugs. Cognitive behavioral therapy, which is a form of counseling, can be useful too. DBS, which stands for deep brain stimulation, is another approach used for people with OCD who do not respond to the treatments mentioned already. Next up is panic disorder. Panic disorder is a type of anxiety disorder characterized by sudden, unexpected bouts of intense, irrational fear and physical symptoms such as a racing heart, difficulty breathing, dizziness, and sweating. Because the so-called panic attacks occur unpredictably, people who experience them tend to live in fear of having it in public or important situations. About 50% of people with this disorder also have mood disorders like depression, as well as other illnesses like OCD. Psychotherapy and medications, generally SSRIs, are usually used to treat this disorder. Finally, I'd like to talk about schizophrenia. Schizophrenia is a lifelong, severe psychiatric disorder that seriously disturbs thinking, emotion, and behavior. The symptoms include hallucinations, delusions, an inability to experience pleasure, and a severe lack of motivation. Many symptoms of this disease do not respond to treatment, and there is no actual cure for schizophrenia. However, people with schizophrenia can pursue personal and professional life goals with the help of behavioral therapy and medications. Scientists have known for many years through various studies that schizophrenia is highly influenced by heredity. However, recently, they have identified more than 100 common genetic misspellings and at least 11 rare ones in the DNA of people with schizophrenia and are now focused on learning more about these genes. These genes are potential targets for new medications. Also, recently, research has uncovered a new perspective for thinking about schizophrenia therapies. Drugs containing nicotine may prove to be useful as future treatments for schizophrenia, since nicotine seems to relax rigid nerve gel shape and function in areas of the brain that are related to schizophrenia. This is the end of the presentation. Thank you.